We hope to have more. We hope you enjoyed this first one. And what we're really trying to do is give people kind of a sense of what's going on, kind of an update on the state of aging in Tennessee. So if your slides are right, you should be looking at a very unglamorous picture of me on the front. I tried to get my staff to take that off, and they refused. And on the right will be the agenda of what we plan to talk about for the next 30 minutes. Really, I'm going to talk for about 20 minutes and then give everybody about 10 minutes for questions. And as I understand it, I think you can type in your questions on the little chat box on the side, and then at the end we'll be able to take as many questions as we can during that period of time. So the agenda, again, we're going to talk a little bit about the Tennessee Commission on Aging and Disability. We'll talk about some results that we've had in fiscal year 17, current needs, resources, legislative updates, and questions. All right? So just to begin, some of the stuff that we do at the Tennessee Commission on Aging and Disability, the services that we do that are funded either through the state or not through the Older Americans Act. Options for Community Living, we've talked quite a bit about that. The Options program is really designed for people who are non-Medicaid eligible. TennCare has their Choices program. We have the Options program for people who are not Medicaid eligible and need some help at home. I think most people know that the majority of folks in Tennessee and around the country want to be able to stay in their homes for as long as possible, and the Options program is really designed to help people do that. Through personal care, homemaker services, meals. We serve about 3,000 people statewide on the Options program every year. And for the whopping cost of about $3,500 a year, not a month, $3,500 a year, somehow we put together kind of a web of services for people to be able to stay at home. Great program. A lot of people want to get on that thing. Currently, we have about just under 10,000 people that are trying to get onto the Options program. Shows how important it is for people who really want to stay at home. The Public Guardianship Program is kind of one of those programs that's I guess you could call it a program of last resort. It's for people who need help with financial decisions or making health care decisions. They've gotten to the point where they can't do it on their own. We have public guardianships in all 9 areas of the state where we have area agencies on aging and disability. Those are the groups that help us do our services. Again, we have 9 of these public guardianship programs across the state. The court uses those public guardians as the last resort. This is a program set up through the state, and it's for people who really don't have friends or family or a bank or a business that can take care of them in terms of helping them make decisions towards when they have a situation where they just can't do it themselves. Senior centers, we provide funding for senior centers across Tennessee for about 125 senior centers. There's more than that, but we've got about 125 that we provide funding for. We don't regulate the senior centers, but we kind of assist them when we can. And they are a great center, a great resource for seniors who are trying to find activities or programs or socialization or things like that. And a lot of times we'll have meals, which we'll talk about in a little while. Sometimes we'll have congregate meal sites at those senior centers as well. The last program, the State Health Insurance Assistance Program, we call SHIP. We call it Tennessee SHIP, TN SHIP, Medicare SHIP. The SHIP program, one of the most important programs that we have, free objective Medicare advice to people who have questions about Medicare. We have a great many people who are on Medicare in Tennessee. I think we have 1.1 million people on Medicare last year. In that fiscal year, we helped 90,000 of those people with advice about Medicare. During the Part D open enrollment period, which runs from October 15th to December 7th, we helped about 18,000 people with questions about Part D. And I will tell you that of those folks, a percentage of about 1,600 of those, we ended up getting them in different programs because we do provide free objective Medicare advice on their Part D plans, and those people saved over $3.5 million. So we saved a lot of people a lot of money in that SHIP program, a very good program, very important. The next slide that you see is programs that are funded by the Older Americans Act. We have the Home Delivered Meals Program. I know that a lot of people refer to that as Meals on Wheels. It's home delivered meals. Those are programs delivered obviously to people's homes. Congregate meals are meals provided in a setting like a senior center. Information and Assistance is a program where people can get resources and other information by calling that phone number. Family Caregiver, one of our more important programs for people who are taking care of people at their homes. Just what it says, Family Caregiver. We do a lot of respite training and respite providing for people. That's providing people some time off from taking care of when they're taking care of an aging parent, an aging friend. Legal assistance, we get a limited amount of money from the federal government. That program is to help folks with either understanding what a will is, some of the things that they need to know as they get older. We have a state ombudsman program. The ombudsman is an advocate for people who are in nursing homes and assisted living facilities. And they basically are across the state. We have 9 of those across the state as well. They go and visit people in nursing homes and assisted living and are there to provide advocacy for people who are in those facilities. We also provide case management services in a limited way to a lot of people who are on the program who need help. Just by talking to people, a lot of times we can give them advice about what they need in terms of services and supports. And then the last one is supportive services. Again, that gets back to sort of what we talked about with the options program. Supportive services, meaning personal care, transportation services, homemaker. We do get some money from the Older Americans Act, and that is provided to people besides our options program to also provide help with them. Just to go back with the home delivered meals, we provide a lot of meals. I think it's close to, I think it's 1.3 million meals that we provide under home delivered meals. Congregate meals, I'm actually pulling up the numbers. You'll see them in just a minute. Home delivered meals, 1.3 million meals. Congregate meals, 909,000 meals. But we'll see a slide like that in just a few minutes that will tell you exactly how many we provide. All right. So now we're going to give you a chance to respond. The poll is, which of these services is most effective to support older Tennesseans in your area? So if you'll see on the right of the screen, that's the question. I've just gone over most of these things: case management, congregate meal, family caregiver, INA. Which of these services is most effective to support older Tennesseans in your area? I guess what I'm asking here is, of those programs that I've just kind of talked about, which ones do you think are the most important? So take a minute and fill in what you think. And as you fill it in, I think you'll be able to see what people are starting to check. So go ahead and take a look at the list. I think I'm looking at the list. I think I've covered everything. If you don't know, that's fine. But fill in what you think. All right, so you see some of the stuff. I think no answer is winning right now. That's good. And that doesn't surprise me, because one of the reasons we're having this call is the fact that we're concerned that a lot of the things that we have available in the aging field, aging services, including through our 9 area agencies on aging and disability, sometimes people don't know that it's available. You know, it's amazing when we go back and talk through, I guess, through different people that are looking for what services are out there, they just don't know. And unfortunately, what we run into are situations with people as they get older. Most of the times, that first call is made when something has happened, when an older adult, an older parent has fallen, is starting to show signs of dementia, and then all of a sudden everybody panics. But we have these things available all along, plus we have that INA service. If you want to check early, it's important because obviously when people wait until a bad situation happens, there's more panic and it's more stress. Now, so those are the lists. I will tell you that one of the things that we always want to stress is SHIP. And SHIP actually looks like either number 1 or number 2 on the list behind no answer. SHIP is, again, one of the most important things that we do. It provides, again, that information on Medicare, which is very, very important. So, federal fiscal year 16, here are some results for you. I mentioned the home-delivered meals. We helped 8,583 individuals. That was an increase from our fiscal year 15. 1.3 million meals were provided. Congregate meals, 909,000 meals. We served 13,556. Again, remember, congregate meals are meals in a group setting, like at a senior center. Personal care services in federal fiscal year 16, 986 individuals, 47,090 service units. That's like a service per hour, a unit per hour. Homemaker, we helped almost 3,000 individuals, and that's 235,000 service units. And transportation, something that's important. Again, all this stuff is important. But through our programs through the federal fiscal year 16 and through our resources, 225,000 rides. And look at the top number, 129,000 people received some type of service from us. That includes all those things, meals, congregate meals, personal care services, and people who were impacted at senior centers. That includes that as well. Still unmet needs. We surveyed 1,700 older adults statewide. The question was, what challenges keep you from being more active in your community? The number one answer, health concerns or lack of health care, 35.4%. Now, people could choose more than one of these, but if you look at the list, you'll see that a lot of those things are kind of interrelated. Health concerns or lack of health care, financial limitations, transportation, a lot of those things show up together. They're all interrelated, and so we look at those. We don't look at them individually. We look at them as a group. All right? Senior hunger, when I first got into this office that's head of the Commission on Aging and Disability, Tennessee was ranked number 2 as the worst state in the country in terms of food insecurity. We wanted to know why. The people who did the survey really couldn't explain that. They asked a series of questions nationwide. Tennessee just happened to come in second worst. So we decided to drill down ourselves. And with the help of Middle Tennessee State University, these are some of the results that you're going to see. We have a problem in Tennessee with food insecurity. 1 in 5 worry whether they're going to run out of food by the end of the month. Food insecure individuals had to choose between buying food and things like medicine or utilities or transportation. Tennessee, as you probably may be aware, has one of the worst dental issues in the country. We typically rank towards the bottom in terms of our senior dental care with mouth and dental problems that causes people difficulty in eating. And then we've talked about transportation. Many can't get access to food due to lack of transportation. We're going to embellish more on the senior hunger study, but these are some of the initial results from that study we did personally in Tennessee to try to find out more about food insecurity. Accessible, affordable housing. I will tell you that this was one of the areas that the Tennessee Commission on Aging and Disability did not spend a lot of time on initially because we had so many other things we were worried about, including a lot of the stuff we're required to do. But this has become much more of an issue as the population gets older. We have, you've heard the number, 75 million people in that boomer population. We have 10,000 people turning 65 across the country every day. Same thing is happening in Tennessee. And so we heard from people who were very concerned about affordable housing. And so with the help of THDA, Tennessee Housing Development Authority, we have put together a joint housing report that's going to be issued relatively soon that talks about senior affordable, accessible housing as a critical and growing need, and that we're going to have to work together to get all this stuff done. The chart you have shows you by East, Middle, and West, people who rent and people who own in that aging category. Most people own. But the concern is as things get more expensive and people's incomes are fixed, they're going to have a tougher time being able to stay in their homes. And for people who are looking for homes, particularly accessible, affordable homes, it's much, much tougher. You're going to hear more about this, particularly when the report comes out. So some resources that we have available. We are working currently on our state plan. We have a plan that's due to the federal government. Every 5 years, we come up with a different plan. We're working on our plan for 2017 through 2021 right now. We have a public hearing scheduled for May 17, 2017. If you're interested, if you'll just contact our offices, we can tell you exactly where we'll be. The bottom thing is the state of aging in Tennessee, a county-by-county snapshot. It shows Shelby County, but in that report, which is available on our website, www.tn.gov/aging, you can get a copy of that report with all the counties in there. County-by-county snapshot. A lot of people are looking at that and using it. It gives you a lot of detailed information. Another resource on our website, you can go to transportation. You can hit the county. It will tell you all the public programs that are available in that county. And remember that we gave over 225,000 rides with Older Americans Act funding in 2015. But now you have a searchable map on the TCAT website. Senior transportation, very, very important issue. Those will list all the public transportation programs that you've got. All 95 counties. Another resource, we just came out with a community resource guide. You see that on the right of the screen. That was initially developed for faith-based. It was going to be a faith-based toolkit, and then other groups saw it and said, well, man, we want that as well. You can get that on our website. What it's designed to do is basically, if you want to learn about fall prevention, or if you want to see signs of elder abuse, but you don't want a 300-page manual to try to figure it out, what we did was we condensed it to a one-page pull-out sheet. And what it does is gives you the bare basics of what you need to know, and then at the bottom gives you a phone number or an email address that you can utilize to find out more information about it. So you can get access to that on our website, and we actually have copies of that in our office that people can get. We also have an online resource database you can go to on our website. Gives you information and resources all across the state. And I've talked about the INA resource line. That's 1-866-836-6678. You call that from anywhere in the state based upon where you're calling from. It gets you to the regional area agency site where they can give you additional resources information. Another poll, what additional resources would be helpful in the future? So I'll give you a minute to, this one, I don't think you're going to be able to see the poll results, but you can type in some additional information that you think, in terms of what you all do, might be helpful for you. Now, again, while you're typing it in, I will tell you that based upon the first answer to the poll, which was no answer, it may mean that you don't necessarily know where to turn. And if you don't, then tell us, because that means that we have to do a much better job of trying to make sure people know that we're out there and that we have tools available. And again, I'll tell you that our staff, the AAADs, people who are involved in this program, AAADs being the Area Agencies on Aging and Disability, we continue to hear from people who either don't know about us or are looking for us because there are more and more people that are getting older in Tennessee. And at the end of this thing, we'll send links to all these resources via email after the webinar is over. So I think I've talked. I usually talk for a very long time. We're looking at whether we have. Okay, so just real quick, I'm going to run through these real quick, and then we'll take some questions. Legislative updates. The first bill, Senate Bill 1230, Elderly and Vulnerable Adult Protection Act, that's a district attorney's bill that is trying to increase the penalties on people who commit crimes against the elderly and vulnerable adults. Very important measure. That is right now, I think, stuck behind the budget, but I think the budget's going to move fairly soon. So, important piece of legislation. And the second bill has gotten through both the House and the Senate. We are extremely appreciative of the House and the Senate for passing this with the Bankers Association. It allows the banks, if they think that somebody is trying to scam a customer, that if they have a reasonable belief to think that something is going wrong, that they can withhold the transaction for a limited period of time, but they can hold on to it and try to check and make sure that a customer is protected. Big deal in Tennessee. Next slide, SHIP, legislative updates. SHIP, we just put on there, again, great program. Every so often it shows up on a list to be cut and from the federal side, and we always encourage our legislators, our congressmen, our senators to remember this program because it helps so many people. Older Americans Act, again, we always watch that just because that's where we get a majority of our funds. Next slide. Time for questions. So I think we have a couple of questions. We have a few more minutes for that. The first question that I've got, is there a waiting list for any of these programs? Unfortunately, with the options program that we talked about, there's currently a waiting list of about 10,000 people. Now, that doesn't mean that all those people are, there's some big line where you just keep going through the list. What we're trying to do is find out those people who have high priorities, who really are in such need. Those are the people who are percolating up to the top, and those are the people we get to first. But right now, unfortunately, that list is really long. We're trying to work through that and figure out how we can actually get that down to size. Home-delivered meals varies by district. If you're trying to get a home-delivered meal, call that information assistance line, and they'll be able to tell you, what the wait is like and whether there's opportunities to get a meal or not. I would also say that they should also be able to tell you sometimes there's the Meals on Wheels program, which is also in the area where if we can't do it, then maybe somebody else can as well. That's the answer to that one. Does TCAT have rental assistance resources for seniors struggling with landlord-tenant issues? I guess the answer is probably not. I think the reason I said probably not is that we start getting more of those things now where people are trying to figure out, they're in a battle with the landlord over something. We'll tell you that we don't necessarily have assistance resources in terms of paying for rent, but we can somehow, or we can try to get those connected to our information and assistance folks. We can work with THDA. We'll try, because we know this is happening. I guess it's fair to say that we don't necessarily have federal programs or state programs that deal specifically with this, but it's been interesting in the last 5 years, all the different things that have come through in terms of things, people that are struggling with different issues, and things that we'll stick with. So the answer is no, but if there's a problem, call us, and we will try to work with you and figure out what we can do. Next question, are there provisions for elderly riders in any of the recently announced light rail plans? So there's a light rail plan that's talking about, they're talking about in Nashville. It's a good question. What I will tell you is we probably haven't gotten as far in terms of that discussion yet, but transportation, big deal. And I think what people are saying is it's a statewide problem, and so state entities are addressing this across the state. We have a program in Blount County, the SMILES program. I know they're working on a program here in Nashville for seniors. There's a program in Jackson, which is getting ready to start. Major program, Senior Ride, My Ride, West Tennessee. Very important program. I know Memphis is working on a program. These are all very, very important things. I think what's happened here is that people understood transportation was such an important senior issue that they started actually creating their own programs. So you're starting to see these things come up across the state. I like the idea of having provisions for elderly riders in any type of new program, including light rail plans. I think it's something to take over and make sure they understand. If you have questions about it, contact us. Call that the Information Assistance Line, or call our number at TCAD, and we can help you with all that. Another question, what are the plans for getting additional resources for aging services in the state? Great question. We try all the time to try to find new ways, innovative ways, how to be more efficient, how to find out if there's some additional resources. We're always looking for grant opportunities. We watch carefully what's going on at the federal side with the Older Americans Act resources. Those are, the money at the Older Americans from the federal government has been pretty stagnant for the last many years. And so one of the things I think that it would be fair to say is that we understand that you can't just wait and ask for more money all the time you need it. It doesn't work that way anymore. So what we have to be is more effective and efficient, partner up, work with the private entities, and try to figure out better ways to actually get money into the program where we're not always looking for government to provide additional resources. We just doesn't work that way anymore. We have to come up with better, effective ways to do it ourselves. Another question, who has to report elder abuse, and where do you report it? By law in Tennessee, everyone is a mandatory reporter. That is in statute. If you think someone is being abused, you're required to report it. What I'll tell you is if it's an emergency, obviously you can call 911. You should always call Adult Protective Services. That is out of the Department of Human Services. The number to call is 1-888-APS-TENN. That's 1-888-APS-TENN. You can always call TCAD. You can report, particularly if it's in a nursing home, assisted living facility, you can call your ombudsman. But everybody, if you believe someone is being abused, you have a duty to report, right? There's been a lot of talk recently about Older Americans Act services being cut. What's the future of those programs? We watch it, like I said. We watch this on a regular basis. We don't know whether, the Older Americans Act has been around since 1965. It's done a tremendous amount of good and continues to be a very important program for people who are older around the country. It gets a fair share of money, but in terms of a lot of other programs, probably not a lot. And it's been stagnant in terms of its growth. But the money that comes from the Older Americans Act is utilized for very, very important reasons. So I don't know. We watch it. We are going to try to protect it the best way we can. There are other states, obviously, all across the country that are involved in this discussion as well. The important thing is to make sure people understand what type of good things that money does, and then make sure that people understand how important the program is. I think I have maybe 1 minute. Let's see, I got one more question. Senior centers haven't seen an increase in funding for a long time. Do you anticipate any additional funding in the future, either state or federal? Difficult to say. We are fortunate that our own state legislature cares a great deal about the senior population. Some of the bills are passing this year or looking at passing are incredible. Tennessee seems to be on the verge of being one of the states across the country that has momentum in trying to protect its seniors from financial exploitation and elder abuse. We're working on other programs in terms of making sure that our legislature understands the importance. Senior centers, I know, haven't seen an increase in funding in a long time, but a lot of programs haven't either. And so what we do is just make sure that any program like that, our legislators understand its importance. So don't necessarily have an answer for it, but we understand the concern. I think we are out of time. So I want to thank you all for listening. I hope you got some information out of it. Thanks for the great questions. You see on the slide our information, how to contact us, phone number, email address, and anything else you want. All you have to do is call us. And we plan to have these webinars in the future. Let us know what you thought. And appreciate the staff for putting this thing together, and I appreciate you all listening. And I hope you have a great rest of the afternoon and a great weekend. And if we can ever provide you all with any help, please let us know. Thank you.